trying to tell you, after your last test, you're home free, and then you can easily go down to Miami and lay on the beach. All right, now today, I had a chance to observe you changing linens, giving baths and oral hygiene, you know, all the things our mothers taught us to do, okay?
Brush your teeth.
Take a bath.
Make your bed.
But here, you'll find that even though it seems simple, you can come across some challenges. I remember when I was in nursing school, I had a patient who had surgery on his left hip, and he was on bed rest, and he wasn't allowed to turn to the left to avoid putting pressure on the operative site. But listen to this. He had suffered a fall prior to having surgery and had a lot of pain on the right hip, too, okay? So because of his pain, he really couldn't be turned to his right side. So how would you go about changing bed linen in this situation?
I would make sure before I started that he'd received his pain medication.
He had his medication. What else could I do?
Well, I would ask for help from a coworker and then change the bed linens from top to bottom instead of side to side.
Very good, Mark. That's what I did. Now, how would you do that?
Well, I would cover him with a bath blanket and remove the top linens as usual. Okay. And then we would help the patient up to a sitting position in the bed, you know, as tolerated, providing the support if he needed it, and then roll them down as far as they would go under the patient. Okay. Then we would apply the bottom sheet, securing it at the top of the mattress.
And to get the soiled sheets out?
I'd have the patient lie back down, and then I would remove the soiled sheets and working them out from under him, you know, from the bed from down to the foot of the mattress.
And as I always say, work toward the feet.
Mm-hmm.
Yes.
And then I would just ease the clean linens from under the patient, pull the sheets taut, and secure the sheets under the foot of the mattress. And I would just apply the top linens.
That's what I did. Very good, Mark. Okay, let's consider this. A patient has had a head injury, which has left her unconscious. Now, part of her nursing care is to provide oral hygiene to prevent drying of her oral tissues. How would you adapt the interventions for giving mouth care to accommodate this patient's needs? Melissa?
Well, first I'd explain what I was going to do to her. Then I'd position the patient on her side with the head of the bed as low as tolerated. I'd put a towel across her chest and an emesis basin underneath her chin. Now I'd lower the side rail. I'd open the patient's mouth and gently insert a padded tongue blade between the back molars as necessary to keep her mouth open. Then I'd gently brush from the gum line to the crown of each tooth. I'd brush both the outer and inner surfaces and back and forth across the surface of each tooth. Then I'd brush her tongue gently with the toothbrush. I'd use a toothette sponge dipped in mouthwash solution to rinse the oral cavity.
Okay.
I can insert the rubber tip of an irrigating syringe into the patient's mouth and rinse gently with a small amount of water.
Well, just make sure the patient's head is positioned to allow for the water to run into the basin, or use a suction apparatus to remove the water from her mouth.
I'd apply lip balm to the patient's lips and then return her to a comfortable position. I just have to document any unusual findings.
Very good. Does anyone have any questions?
Oh, I do.
Okay.
I provided oral care to a patient today. Now, she didn't have any dentures, but if she did, how would I go about cleaning them?
Oh, I know. I actually had a patient with dentures today, and I helped with the removal and the cleaning.
Mm-hmm.
So to remove the upper dentures, I applied gentle pressure with a piece of gauze to grasp the upper denture plate and remove it. Mm-hmm. And then I placed it in the denture cup.
You know, depending on the patient's preference, denture cleanser can be added to the cup with water according to the package directions.
Right. To clean, I brushed the denture thoroughly with the toothbrush and the toothpaste. The problem is, no matter how careful I am, I'm always worried that I'll break the dentures.
Oh, well, all you have to do is just place a paper towel or washcloth in the sink while brushing to prevent breakage, just in case you drop the dentures.
Okay.
And then just rinse the denture with water and return them to the patient. Well, you all did very well today with what I observed. Let's meet back tomorrow.
Okay.
You all have a good night.
Sounds good.
Good night,
I'll see you, Miss Scott.
Thanks.
I'll see you guys later.
See ya. Oops, Mark. You dropped something.
What is this?
It's a sci-fi book.
Earth to Mark.
Woohoo!
Okay.